At the end of it should have been anticipated that there would be a rush to establish outreach facilities for this scheme, and private sector responded. So it is the regulating authority that should have anticipated this process and stayed up to date. And I realized the Medical Practitioners and Dentists Board meets once in 3 months. That was a system too weak for a project of this magnitude. They would have needed to meet weekly, inspect the facilities weekly, update themselves. That is where systems began to break down. We would have expected the Quality Assurance Department to be visiting non-stop all these facilities. Otherwise, private sector initiatives to exploit this program where 8 billion shillings of new resources is coming to the health sector has run out of the administrative capacity. Education and health is the biggest problem for all MPs in all constituencies. So as far as we are concerned, we want the scheme to go on, improved as we go on. And the results in the last 3 months may have been messy as they are, but I think the issues can be addressed to achieve the objectives for which the scheme was initiated. That runs you quick through the summary of the rest of the presentation.
In your baseline survey, is your statement here indicating that that survey proved to you that public hospitals could not effectively provide service to public servants, and therefore, in fact, further justifying that public servants needed to go to other providers outside public hospitals that you are created as a ministry to oversee? Or rather, people tried?
Chair, look, I think we are talking the same language, really. All I'm saying...
We are saying the same thing.
We are saying the same thing. All
so
I'm saying...
what you are saying is the same as our hospitals are neglected, and therefore they are not in a state to be giving healthcare services for the civil servants, the outpatient scheme. That is where we are.
I wouldn't say all. I mean, that would be a very blanket statement. All I'm saying is that the reason why we are undertaking this rehabilitation project for our hospitals is to respond to this neglect and to make sure that they deliver services to people adequately, efficiently, and cost-effectively. This particular contract, Chair, gave the civil servants a choice between the private sector and the public. All I'm saying is that we should be able to compete with the private sector by upscaling our services so that they can be attractive to the clients. And I gave you the example of Kenyatta, for example. Kenyatta should not actually be offering outpatient care, really. Kenyatta should be a referral facility. But precisely because clinics in Nairobi completely ground to a standstill over time, Kenyans go to Kenyatta for outpatient. And Kenyatta found that some of the Kenyans coming as civil servants who don't want to stand in the long queues with Anichi, so they opened up a special corporate department upstairs to be competitive in the market. It's a good example that I think our other hospitals should follow, so that we serve different types of clients. So that instead of going to Nairobi Hospital, I can choose to go to Mbagathi and Kenyatta because the services are competitive. That's all I'm saying, Chair.